Oh, good.
Well, thanks for everyone for jumping on here. I think, Greg, my understanding is that Dr. Giesel, Krista, is going to be running the meeting, chairing the meeting for us today.
Right. Yeah, my Wi-Fi kind of isn't too good where I am, so I'll chime in when possible, but I may not be able to stay the whole time. So I think she's got it, but I'm here, and Patty's here also.
Great, thanks so much. And Krista, we're at 1 o'clock. If we want to see if we have, I think we've got quorum here to be able to kick off the meeting, and you're muted still.
Here we go. Can you hear me now? Thank you. I'm going to call this meeting to order. Jordana said we had a quorum. I'm hoping that everybody had a chance to review the minutes from the last meeting. And if so, if we could entertain a motion to approve those minutes.
I'll move to approve.
Thank you, Jeannie. We have a second.
I second it.
And Linda seconded it. All those in favor, raise your right hand. Perfect. And anybody opposed? All right, great. Minutes are approved. We are going to turn this over to Jordana now for an update.
Thank you, Krista. Thank you for pulling up the slides here. And if we go back to the beginning here, you'll see that we all have been brought back together to be able to, if you can just go forward 2 slides, please. Thank you. Address the major changes that have happened in the COVID policy landscape since we were in our last meeting on May 13th. During actually just, I think, an hour or an hour and a half or so before our last Board of Health meeting, the updated CDC guidance was released. Since that time, the state has updated their public health orders. Surrounding counties have aligned with the state public health order, including but not limited to Eagle County, Summit County, Garfield County, Routt County, Clear Creek, and Lake, just as of June 1st. Additionally, with the COVID policy landscape, the federal mask order that requires masking to be worn regardless of vaccination status in transportation settings continues to be in effect. Next slide, please. So I just wanted to really outline what the CDC guidance was that was updated. And it states that individuals who are fully vaccinated can resume activities without wearing a mask or physically distancing, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local business and workplace guidance. What we have seen has been an uptake in vaccinations since this was announced. Similarly to what we saw in an email Greg forwarded to an article Greg forwarded along to the board, is that one of the most compelling reasons to get vaccinated from a survey done by Americans across the country was that it was required to be vaccinated in order to participate in regular activities. So that was a really important factor in individuals making the choice to continue to get vaccinated, knowing that that was what it was going to take for them to be able to get back into those normal, regular kinds of activities. And so I think this is definitely the line of thinking that the CDC was using when passing this guidance, or when releasing this guidance. Next slide, please. This slide continues to work through and just share some of the nuances of the differences between activities when someone's fully vaccinated or unvaccinated, and the prevention measures that the CDC guidance is stating when additional prevention measures should be taken. You'll see on the right-hand side, those fully vaccinated people are not being recommended by the CDC to have to take additional prevention measures in a number of these situations because they are fully vaccinated, and we know that the vaccines up to this point have been extremely effective. When we look over on the left-hand column, we see that unvaccinated people are still really being recommended to take prevention measures in a number of different situations. It's basically just when you're outside walking, running, hiking, or outside in a small gathering of all other folks who are of vaccinated status. Those are the circumstances in which the CDC is saying that if you're not vaccinated, you don't have to take additional measures. In all other circumstances, those that are not fully vaccinated are still being recommended that masking, distancing, washing hands are measures that should be continually taken either in outdoor crowded settings or in indoor settings if you're around anyone else that's beyond your household. So, I think what we're seeing is that while the CDC is still recommending masking and other prevention measures for those that are not vaccinated, we know that that this can also fall to businesses, employers, and localities who are permitted to have any additional policies in place to assure that the guidance is being followed, or any additional policies in place that would need to be followed. So we can encourage and offer support for those businesses who might need to have policies that work for their own situations, depending on what that is. This guidance really allows for more flexibility in allowing that additional regulation to happen at the local or business level. We do really want to take a minute here to reflect back on the businesses that we heard from last Board of Public Health meeting, who have put in vaccination verification processes. While this not only encourages individuals to get vaccinated, as we know, that's one of the most effective motivations, but it also really communicates the safe environment that patrons can expect when attending or participating in that kind of event or business activity. I just want to take also a minute to think about the fact that even with this guidance, wearing masks indoors is still going to be the right decision for many people. People who have not been vaccinated, people who are immunocompromised, people who are setting examples for kids who are too young to be vaccinated and still need to wear a mask, and need to see their adults around them also following those rules and guidance, or those who continue to wear a mask for an extra layer of protection, because we know masks still continue to be one of the most effective tools that we have in preventing transmission, second to vaccinations. While, so masking isn't necessarily in this situation going to indicate vaccination status. We know that individuals are continuing in other places where the mask order, where they've gone to CDC guidance, masks continue to be worn for various reasons. The other aspect of this is that The more that we can assure those higher vaccination rates and compliance with the CDC recommendations, the less likely we're going to see transmission, and the less likely it will be that we'll need to implement those additional protective measures, as we're all probably very well aware of the step back metrics that come into place as we're monitoring our hospital capacity. Moving along to the next slide, please. I just wanted to outline those state and federal public health orders that are currently in place. We see that face coverings are still required in certain settings for individuals aged 12 and older at the state level. Those settings are for anyone who is unvaccinated or not fully vaccinated in an indoor school setting, in the Colorado Department of Motor Vehicle offices, in prisons, in jails, as well as personal and emergency medical or other healthcare settings. And then nursing homes also have some additional restrictions around them and those kinds of settings. Additionally, we've talked about the requirement for those that are age 2 and older to wear masks on public transportation. This again is regardless of vaccination status. So that masking requirement does continue to exist throughout the country. Next slide, please. I thought it would also be helpful to share with the board some of the work that's been happening around messaging already. Our comms team has really started to come back and revisit the evergreen messaging as we've all become familiar with the 5 commitments. One big recognition was that the 5 commitments were from a time before immunizations and vaccinations, and that we needed to do some refreshing as to what the messaging was that we wanted to do to be able to include the importance of vaccination in our community. And so this is some of the things that comms team have been working on. This is on the website now. A healthy summer starts with you. This is the respect and responsibility campaign that has kind of four components here: to get vaccinated, to socialize smart. The next item there is to stay home if you are sick. This continues to be an important norm that we're all really having to invest in and become a part of our normal everyday to-day lives. That staying home when you're sick, regardless of your vaccination status, is going to be an important piece to reducing transmission, and then just to keep washing your hands. And the next slide, please. Just a quick illustration of our data. We continue to have low case counts, low numbers of COVID cases in our county. And we continue to see steadily increasing vaccination rates for our Pitkin County residents. We currently estimate that we have 63% of our residents that are fully vaccinated, and 75% of residents that have received at least 1 dose. We are committed to continuing to offer vaccinations with a focus on making it convenient for anyone who wants one in Pitkin County. In that article that Greg sent along, the other major factor in what was influencing individuals to get vaccinated was convenience, how easy it was. And so as we've shared with this board, we've moved from that mass clinic model of having people come to us to now us going out to where people are who may need to be vaccinated, making it as easy as possible to have those smaller scale pop-up clinics, having additional street team members go out and let businesses or folks in the surrounding areas know that the clinics are going on. They don't require appointments. You can just walk up and get vaccinated. So that is a piece of our strategy that we're working on, and that will continue to be a part of what we do this summer. Next slide, please. So this brings us back to the May 13th Board of Health decision. You'll recall at the time, the state mask order was that all individuals are permitted to remove their mask in public indoor spaces if 80% of the individuals in the public indoor space have shown proof of vaccination. And so at that time, the board voted to align with that state order, as well as require proof of a negative test for those without proof of vaccination. So at that time, that policy was in alignment with what the state policy was at the time, and offered even a little bit more protection. As I've stated, since the board made this decision, much has changed. The CDC guidance has changed. The state public health order has changed. The surrounding counties have changed to align with the state guidance to be able to allow fully vaccinated individuals to remove their masks indoors. We recognize that the way that the guidance and then the state update to the order that was rolled out has led to a lot of confusion. And then our order, which no longer aligns with the state order, it continues to contribute to a lot of confusion. And we recognize that this has really been coming to a head and putting pressure on businesses who are then not only required to enforce our local order, but also to inform and try to explain the differences of why, what the local requirements are. We did receive feedback from ACRA and the Basalt Chamber asking for a reconsideration of this current public health order before the next regularly scheduled meeting next week. And their statement was just it was too long to even wait that until then for this issue to be revisited. With all of those updates and considerations that have been put into place, if we go to the next slide, the staff recommendation is that we do issue a local public health order to align with the state public health order as of 12:01 a.m. June 4th. We would also continue to communicate the vaccination benefits and opportunities, the CDC recommendations on masking. We understand that even if we do align here, there's still going to be a lot of work in the communication realm to be able to let folks know what not only what the recommendations are, but the reasons behind that, and that businesses can require more protective measures be put in place. We have our community liaison team there to support businesses who are asking questions or wanting support. There's a recently developed business playbook that outlines considerations for businesses to think through as to what will be best for them. And then finally, back to this respect and responsibility messaging. I think that people are going to need respect for these more localized policies that either businesses or localities or employers put into place. We know that federal masking requirement in transportation applies to everyone. We're going to be asking for respect and compliance with that. And then also respect that individuals are going to be making choices to either mask or not mask, depending on a variety of factors that we've discussed today. We need responsibility for everyone to follow the recommendations, to carry a mask, to be used in the situation that requires it, and to respect these policies that exist, as well as individuals' choices. I do want to recognize that a number of the businesses who, the performing arts groups and the Belly Up, who shared their policies and procedures that they were planning on putting into place to comply with our current public health order, that there is still interest from those businesses in continuing to keep some additional policies in place. And, you know, I think from our perspective, we really applaud and support that for the reasons discussed of, you know, encouraging vaccination, and then also ensuring that those are safe environments for folks who are choosing to engage. Before I turn it back to you, Krista, I just wanted John Peacock, if he's able to jump in here and just give a little bit of insight on this recommendation to provide a local public health order, even though what we're doing is just aligning with the current, the recommendation is to align with the state public health order and the federal order. And what the reasoning is to have our own order also in place, outlining that.
Yeah, thanks, Jordana. Can you hear me okay? Is my audio coming through? Thank you. So really two primary reasons. The first is as a result of COVID and the response to COVID, we have seen an increased number of homeless in the community. And so we do have the safe outdoor space, which has been set up at the Intercept lot. That property is actually owned by CDOT, leased by the city, and during the crisis, we gained permission to use that space for the safe outdoor space, so long as we had a local emergency declaration and a public health order responding to COVID in place. And so this will allow us to maintain that safe outdoor space. I do think the housing issues that have been driven through COVID response are probably going to last, not hopefully, but they'll last longer maybe than the virus in our community. The second reason is that the state has not always given us a whole lot of indication when they're going to make a move and what move they're going to make. And maintaining your own local public health order does give this board a little bit more control over timing of changes. That's it.
Great, thank you. Thank you, Jordana and John. We're going to move to public comment in just a minute, but I'd like to give Board of Health a chance to ask any questions of the presentation or of John Peacock that you might have right now.
I'd like to comment.
Go ahead.
I would like to have the performing arts facilities, which are not strictly businesses, listed as the businesses are. In other words, businesses are may require protective measures, as well as the performing arts facilities in the community, such as the Wheeler Opera House, Aspen Music, Theater Aspen. In other words, have those listed even though they're not necessarily businesses. In addition, I think the employers and the businesses are really going to be the protective cops in what is following. And we need to anticipate what might be happening after the 4th of July. And I suggest that we convene a Board of Health meeting on Thursday, July the 15th, to see how the first 2 weeks of July have gone.
Thank you, Dr. Kurt. Anybody else? Patty?
Yeah, you know, in light of, I'm sure everyone has received Kelly McNicholas Curry's letter. She had talked to the BOCC when we discussed this on Tuesday, whenever that was, 2 days ago. Kelly's concern is the protection of those under the age of 12. Her children are 4 and 2. I know that we can't ask the world to remask again. So are there any suggestions or recommendations we can provide or guidance we can provide for parents or caretakers of children under the age of 12 who cannot be vaccinated? Such as maybe they're just going to have to wear masks in outdoor and indoor settings if the parents are uncomfortable. I don't know if there's any specific guidance out there. So I'd like to provide something for Kelly so she feels more comfortable going about her life with her children and other parents.
I can respond to that, Patty.
Jordana, any great ideas?
Yeah, I mean, they're included in the recommendation to continue masking because they can't be vaccinated. So, you know, they're encompassed there. We can definitely hone in and create some additional messaging in the community that highlights that for kids. But that is where they would be scooped up and addressed.
I just wanted to add to that too, Patty, because I think just in thinking about even calling this special meeting, like, I don't think the recommendations of our board is changing, right? Like, we still recommend masking because we do realize it's safe, and we still feel like that's a way to protect all of ourselves, including our children unvaccinated during this pandemic. What we're doing is having to, like, you know, respond more to kind of the forces that are going on more around like a public order. So I think the basis of our the 4 commitments now, or whatever they are, masking, those are all still some things that we want to make sure everybody's aware of, like Jordana said. And Linda, I saw your hand go up. Do you have a comment to add too?
Well, the American Academy of Pediatrics does recommend that children from 2 to 12 be masked in large groups situations like daycare and that kind of thing. And that the parents, even if they're vaccinated, try to be the example for the children, so that the children, especially small children who don't understand quite yet what's going on, so that they see their parents masked as well. And in those particular situations of large groups especially. So I just wanted to say the American Academy of Pediatrics does recommend that in children, unvaccinated young children.
Great. Thank you guys for that input. And I'm sure Kelly is tuned into this meeting. If not, I'll make sure that I pass this along to her. Thank you.
Great, thanks. I think there's a few other people on here, so I think at this point I will open it up to public comment.
Great, thank you, Krista. So I have enabled the raise hand option for those calling in. You can raise your hand by pressing *9, and then mute and unmute is *6. And I will call people one by one if they would like to make a public comment.
Tori, do you have a comment?
While we're waiting for any members of the public to get on, I just had 3 items I wanted to maybe have a quick discussion about. Jordana, I was just wondering about other counties. Are there mask requirements still in the state of Colorado anywhere?
Tori, I can look. It's not, I would just have to look at every county's public health order that's currently in place. So I can look, but I don't know that off the top of my head. The ones I've listed are the counties I looked into specifically that are our neighboring counties who have all aligned.
Okay, that's plenty. That's all I was wondering. That's enough for that. I also just want to make a brief comment about some of the communication, Jordana, that you had highlighted going forward. I was wondering how testing might fit into this as we move forward. You know, we still have the facility behind City Hall. In brief conversations, I know that actually their account is that many visitors that are arriving to town are taking a test upon arrival, which was great to hear. And so I just wanted to make sure that maybe in the communication going forward that we also touch on testing, the value of testing, and how to use testing as we kind of move into these new regulations if we do that today. So I just want to make a comment to that to make sure that testing is still being facilitated and utilized by the public as it should be. And then my last thing that I just maybe a question, but we talk about snapback measures. Are there maybe thresholds that we're looking at that could trigger reenacting a mask mandate for indoors? Do we have those kind of foresight on maybe conditions as we go forward?
At this point, Tori, what we've been using for our snapback measures are to look at local hospital capacity. And so we are in the process of continuing to update and tweak our local hospital dashboard so that we're looking at how we're doing with inpatient capacity, number of employees able to be working who are not out sick due to COVID, which was a problem early on in the pandemic. And then, ability to not only take care of those patients, but the need to transfer. Is there an ability to transfer to a higher level of care? So all of those measures are being looked at locally. The other measure that we're keeping an eye on is around our RETAC, which is our regional hospital area capacity. And so that is something that we'll be adding to our dashboard to be able to be monitoring. And the state has set that threshold at 85%. And if that flags, the state will go looking into what's causing that increase in capacity and then make some determinations from there.
Thank you. I appreciate all that information.
All right, I'm not sure we've had any interest in public comment. And if not, should we have a Board of Health discussion? Oh, sorry, go ahead, Kim.
Can you hear me okay? Okay, great. I'm using phone and computer at work. I just wanted to make a comment that I see what's occurring today to be kind of in the name of simplifying policy and making consistency. And that priority has somewhat prioritized over safety. And so what Jordana was mentioning in terms of the responsibility and respect campaign is going to be the utmost importance as we move forward. Really respecting others who continue to choose to wear masks and businesses who continue to uphold mask measures. And you don't know what's behind somebody's medical condition, someone who's immunocompromised, has solid organ transplant, for whatever reason, if someone chooses to wear a mask. And that's part of the respect and responsibility campaign that I see in terms of respecting each other. And this is really, we're entering this phase in the pandemic where this is the most important. We all know that the pandemic is alive, it's here. There are breakthrough cases, meaning there are people who are vaccinated that are getting cases. There are rise of variants. And you look internationally and worldwide, and this pandemic is really rampant. So we're lucky where we are we have a high rate of vaccination, but we are certainly not at what this elusive herd immunity is. And so it is utmost important to maintain safety and respect others. And I just wanted to make that comment. Even though we're voting on a policy decision, it's a little bit of policy and consistency over health at this point.
Thank you, Kim. So at this point, can we have a discussion from the Board of Health on the recommendation made by Public Health? Dr. Kurt?
I move that we go forward in approving the Board of Health, the public health recommendations. But I would like to add on what I suggested, where businesses may require more protective measures to include the arts groups within that, such as Jazz Aspen, the Wheeler Opera House, because I'm a board member of the Wheeler Opera House and I'm aware of those things, Aspen Music, etc. In addition, I'm suggesting a meeting on July 15th, which is a Thursday. So we will have the first 2 weeks of July to review, which will be critical with the tourist season starting, if we need to take any modifying measures at that point.
Great. Well, let's talk about at the end of the agenda is the next board date. So let's leave that. But I did hear you say that there's a motion to approve the recommendation with an addition to the language. Jordana, what I remember it's saying is basically we're going to align with the state public health order, which did not necessarily specify specific businesses. Is that true?
That's correct.
Okay. But in your motion, Dr. Kurt, you want specific businesses added?
They're not necessarily considered businesses. They're nonprofit groups, such as the Wheeler, Aspen Music, Theater Aspen, and Jazz Aspen. Those be included in that business statement.
Patty, you want to say something?
Get off mute. Oh, there we go. Sorry. I'm not, I generally agree with Dr. Kurt on this one. I don't think if we start specifying nonprofits, there's a whole gamut that have special events and do things. I just think if we make it clear that local businesses may determine their own mask requirements within their business, that keeps people to the fact that you might go into the miners building, they have no mask requirement, and the Emporium and Flying Circus next door does. It's really up to the business owners or the event, whoever's putting on the events. So I don't know how we can capture that without specifically naming certain businesses, because that then somebody else might feel left out of the loop, Tom, and wonder why their nonprofit wasn't listed there. So I think if we find a way to capture that, it might be better rather than be so specific.
Go ahead, Corey.
Comment there.
Perhaps the simple addition of languages, businesses and organizations. I think Dr. Kurt's main point here is that those that don't fall under the traditional business definition are the ones that his concern is for.
And I would just make one, what we have in there is other entities right now.
Could you put it up for us again, Jordana? Would you mind just putting it back on the screen so we can all see it?
That doesn't have that specific language in it, but in the order language that I've been drafting and working with our attorney on, entities is the word that expands businesses and other entities.
Dr. Kurt, what do you think about that?
That's excellent. I agree.
I'll second the motion.
Any further discussion around this? I don't see any hands, so I will go ahead and call the motion. All those in favor, please raise your right hand. Anybody opposed? The motion passes. Great, so thank you, Jordana, on that. And then, yes, I did want to have a discussion around like the next board meeting dates, just because we've had this meeting today that they had to prepare for. Now there's supposed to be one next week. And then I think, Dr. Kurt, you bring up a really good point about July. I'm wondering if we should not have a meeting next week since we've had this today and they've done so much work on that, and maybe consider a different date, whatever our July date was going to be. I don't know if you guys are comfortable pushing it to after the 4th of July and having our next meeting on July 15th. But I think this is something to consider just because they have done so much work in this meeting today, and I'm not sure. We could talk about other topics besides COVID next week as well. But just some of your thoughts on when we should meet again.
Agree with you, Krista. Make the suggestions.
So I would suggest that our next meeting, I think, is July 15th. Is that the Thursday? Is that the right date? Can I make a motion if I'm the chair?
I'll make it for you.
I'll second it.
All those in favor of our next Board of Health meeting date be moved to July 17th, please raise your hand. And
15th.
15th. Anybody opposed to that? Okay, great. Well, thank you all very much for coming to this meeting at very short notice, and Jordana, all the work and your team has done. We really, really appreciate it. And if we have nothing else to accomplish it, sorry, Greg, go ahead.
I'm turning off my video and turning on off the mute also. Hopefully you can hear me. I just wanted to say thank you for doing this. I think this is a step forward, and I want to, we talked about snapback. We've talked about all the safeguards here. I think this is the right thing to do now. And of course, if we have to change it and modify it, we will. So thank you for that. I did want to bring up the state, as we all may know at this point, has a $1 million lottery for a vaccination lottery. If you've been vaccinated, you're automatically entered. They just announced today a $50,000 scholarship for kids between 12 and 17. I think they're offering 500 of them across the state, something like that. And it seems like an awful lot of money to encourage somebody to get vaccinated. And I'm just wondering if we could incentivize people locally, if our businesses and our events who have the most skin in the game regarding staying in business this summer have an interest, perhaps they could do something like that with maybe there's a way we can do a lottery for tickets to events, passes, things like that, special events maybe that can, have lower value, but still be of value to encourage that 1/3 of the hesitant people who haven't been vaccinated to go ahead and get it done. I think maybe, according to this rule, was it 1/3 of people are hesitant because of would be incentivized, would get vaccinated, and 1/3 said it was a problem of availability. So if we make it more available, and maybe we can offer some local incentives, we can just keep pushing toward vaccination and make everybody feel safer. I just wanted to bring that up and hope to propose it, and maybe some ideas will start circulating. And I certainly would be happy to help however I can with that. Thank you.
Thanks, Greg. That's a great idea.
And Krista, we will have to have a formal vote to adjourn the meeting or motion.
Does anybody
Motion to adjourn.
Is there a
Greg.
motion for it? Tori?
I'll second it.
Perfect. Did somebody make it? All right. Thank you, guys. We are
Yeah, I did.
adjourned.
Greg did.
Everybody.